What differentiates the OSSIX Plus membrane from other grafting materials?
The OSSIX Plus membrane is a completely different type of membrane than any other material we have available. It is programmably cross-linked with ribose, which is one of the ways that collagen is cross-linked in the body. So the body does not recognize this as a foreign material, and it is the only collagen membrane that is capable of calcifying once it is implanted into bone defect sites.
Is there a difference in the way that it is used with other grafting materials like allograft material?
I would say that I'm more aggressive when using the OSSIX Plus membrane around allograft materials, ridge augmentations where perhaps blocks would be used or meshes would be used. I'm using allografts, maybe supported with tenting screws, and just laying the OSSIX Plus over the site and getting very predictable and robust regeneration.
How about small defects or extraction sites? Is it changing your protocol for the management of those?
It is. The OSSIX bone in small extraction sites is allowing me to perform much more conservative surgery. We don't have to raise flaps. We debride the extraction site and we place the OSSIX bone into the site much like you would a hemostatic plug, except that this is actually a bone regenerative material. And we just place a suture for hemostasis, not trying to achieve primary wound closure. And we get very favorable, predictable soft tissue healing and bone regeneration.
So the OSSIX bone, is that more or less conservative?
It's more conservative because the ease of use is so simple that the treatment time itself in the chair for the patient is considerably shorter, and we're not manipulating the soft tissue to apply a membrane beneath the periosteum. So it's not only a shorter procedure, but there's less morbidity associated.
Are there other competitive products, and how do they vary from OSSIX?
In terms of membranes, all of the competitive collagen materials are either not cross-linked and basically don't function as a membrane in terms of cell exclusion. They're simply short-term graft containment devices, or they're cross-linked with chemicals such as aldehydes, which make them cytotoxic, so they have to be managed in terms of their production so that the cytotoxicity is reduced, limiting the amount of cross-linking. So their barrier function time is significantly shorter than the OSSIX material.
Typically, what is the waiting time before you feel comfortable placing an implant in a site that you've grafted with OSSIX materials?
Well, if I'm going to use a mineralized allograft in, say, an extraction socket and cover that with an OSSIX Plus membrane, regardless of closure, because we know the soft tissue will heal over the OSSIX Plus, basically it's a 4-month waiting time. If there's any kind of a buccal wall defect, we may wait 5 or 6 months, depending on the extent of that buccal wall defect or the size of the extraction socket itself. But typically 4 months is satisfactory to re-enter. And typically what we find is the more superficial layer of the OSSIX Plus peels out without any inflammatory reaction, and the inner layer is normally white and chalky, demonstrating that it's actually calcified.
What if you don't have primary closure in a grafting site? Is that an issue?
With OSSIX Plus, it typically is not an issue. My own protocol is over the exposed portion of the membrane, I may use a double layer. And typically by 4 months' time, there's no evidence that a membrane was there, and we have a good, hard cortical layer of bone over the crest of the extraction socket.